Good afternoon, good evening. It's a pleasure for me to welcome you here for today's program on Israel's response to the COVID-19 pandemic. My name is Avinoam Patt. I'm the director of the Center for Judaic Studies and Contemporary Jewish Life at the University of Connecticut, where I also serve as the Doris and Simon Conover Chair of Judaic Studies. Before we begin today's program, I just want to take a moment to acknowledge that today, October 27th, is the 3-year anniversary of the attack on the Tree of Life Synagogue in Pittsburgh, which took 11 lives and wounded 6 others, making it the deadliest anti-Semitic attack in United States history. May the memories of all those lives taken, may their memories be for a blessing. Today's program on Israel's response to the COVID-19 pandemic is co-sponsored by the Center for Judaic Studies at the University of Connecticut, the Office of Global Affairs, Middle East Studies, and the Taub Center for Social Policy Studies in Israel. As we gather here today on Zoom, we note how familiar we have become with this sort of remote program, which has become somewhat normal in our pandemic times. These programs, which enable us to bring together scholars from around the world, are indeed one of the silver linings of our response to the pandemic. As we adapt to living with COVID, we still have so much to learn, and we realize how much we can benefit from sharing knowledge globally, especially as we seek to confront a virus that knows no borders. Many of us here in the United States have looked to Israel, first to see how nationwide adoption of the Pfizer vaccine would work, and then how quickly the Delta variant would rear its ugly head. Israel went from being the world's poster child in the rollout of the COVID-19 vaccination to having the highest number of cases per capita. How and why did this happen? And what can we expect going forward? I'm so pleased to be joined by experts from the Taub Center for Social Policy Studies in Israel, an independent think tank based in Jerusalem, for an insider look at the impact of the pandemic on Israel's diverse society. In a moment, I will introduce our speakers, but I just want to offer a couple of technical notes on how today's program is going to work. So we will hear from our experts from the Taub Center, and as they are speaking, feel free to use the chat function at the bottom of your screen to ask questions, and we'll have time for Q&A, plenty of time for Q&A at the end of our program. You'll see that participants have been muted upon entry into the program. This is to minimize disruptions during the program itself. But if you have a question that you would prefer to ask in person rather than using the chat function, you can raise your hand when we get to the Q&A portion of the program, and we'll allow you to unmute yourself so you can ask your question in person. So our 3 speakers today will be Suzanne Patt Benvenisti, who's the Director General of the Taub Center, Professor Avi Weiss, who is the president of the Taub Center, and Professor Nadav Davidovitch, who's a principal researcher and health policy program chair at the Taub Center. I'll introduce each of them right before they're going to speak, but for now, it is my great pleasure to introduce my sister, Suzanne Patt Benvenisti, who is the Director General of the Taub Center. Susie's previous work experience includes serving as Director of Public Policy at Aetna, a United States-based Fortune 100 health insurance company, where she advised on issues relating to healthcare reform. She has also worked for several nonprofit organizations in the areas of programming and resource development, and has provided management, strategy, and operations consulting to a range of clients in the United States, Israel, and Rwanda, including MIT's Middle East Education Through Technology program, the Agahozo Shalom Youth Village in Rwanda, Maine's Community Partnership for Protecting Children, and the Judge Baker Children's Center at Harvard Medical School. So Susie, it's a pleasure to turn the screen over to you.
Great, thank you so much, Avi. It's a pleasure to be here with you specifically today and with all of you. And I want to start off by telling you a little bit about the Taub Center and what we do. And then I'll speak a bit, just give a little bit of background in terms of what the Israeli population looks like before I hand things over to Avi and Nadav to speak more about how Israel is weathering the pandemic. So the Taub Center was founded in 1982. Our mission is to conduct high quality socioeconomic research. We focus on 5 key policy areas: health, welfare, education, labor markets, and macroeconomic policy. And recently, we've delved more deeply into 2 additional areas: early childhood and demography. And basically, as we look at these different areas and through these areas look at how they affect different populations in Israel, we're trying to ask 2 kinds of questions. One is to look at areas, issues that are at the top of the policy agenda, but we have the sense that there isn't really a deep enough understanding of what the underlying issues are. And in these cases, we have the opportunity to do analysis on the various data that are available in Israel and try to shed light on what's actually going on in order to improve policymaking in these areas. And the other area is really issues that we see as being critical, but are not yet sufficiently a focus or sufficiently on the policy agenda. And we try to bring attention to those issues. And as we're doing our research, we don't leave it within the walls of the Taub Center. We work very hard to share that research widely with policymakers and the public. So through a variety of different types of activities, we share our research. For example, through meetings like this one, whether lectures on Zoom or in person when we could do them like that, conferences. For example, next week, we are holding our annual international Singer Conference. And in fact, Jay Sandak, the president of the Herbert and Nell Singer Foundation, who is based in Connecticut, is here today and sponsors this conference, which is taking place on Tuesday and is focused on the topic this year of distance by design, looking at how the remote technologies that have really developed that have come to the forefront over the course of the last 2 years or so, how they're going to change the way we interact in the fields of education, labor, health, and other areas as well. And so we have conferences like that. We put out videos and podcasts. We have direct meetings with policymakers and ongoing consultation with policymakers to try to share the work that we do with them, and in order to try to help them as they're facing different decisions and developing policy in Israel. And through all of that work, we aim to have a positive impact on public policy in Israel, whether it's inspiring legislation or public programs or policy or philanthropy, whether it's shaping the public discourse or serving as an ongoing resource for decision makers. And some examples of the type of impact that we try to have. For example, our research director, Professor Alex Weinreb, recently put out a paper focused on the demographic changes in the South. And what's been happening in the past, and from that, what we can expect and what we need to, what type of strategic planning effectively needs to be done in order to address these changes. And that's been taken on the road and shared with a variety of mayors, with the welfare minister, and with a variety of different stakeholders who can actually take that research and use it in order to have an impact and to change policy as needed in Israel. Avi Weiss, who we're going to hear from in a minute, met yesterday with the Minister of the Economy and serves on various advisory committees. We do a lot of advising on early childhood. For example, we had a meeting today that brought together a variety of stakeholders, a Zoom meeting that brought together a variety of stakeholders focused on early childhood education. The head of our early childhood program serves on an advisory committee in the education ministry that's focused on trying to have an effect on improving the work of the education system and recovering from the deficits that were developed over the course of the pandemic, particularly among very young children. Nadav serves on the advisory committee for the health ministry to essentially figure out how Israel is responding to the pandemic, and has a great impact there. So this is really the type of work that we do. And at this point, I want to just delve in and give you a little bit of background about Israel, just to ensure it may be information that many of you know, but I just want to make sure we're all starting off on the same page. So I'm going to share my screen here. Moment. Okay. So I just want to speak a little bit about Israel's demography. As you may know, Israel is...
Susie, there's a problem with the slide. We can't see the whole slide. We're only seeing a little bit of it.
Oh, okay. Thank you for telling me that.
That second slide was fine. The previous one was not.
When you press escape, probably it was okay.
Okay. Now, can you see it? Okay,
yes.
Thanks. Great. Okay, so the Israeli population is broken down into several different groups, and it's a relatively diverse population. We have 74% of the population is Jewish, but among the Jewish population, there are a variety of different subsectors. So we have 30% of the overall population of Israel that would consider themselves to be secular Jews. And on the other end of the spectrum, we have 12% of the overall population in Israel that considers themselves to be Haredim, which is ultra-Orthodox Jews. And then in between, we have a variety of different levels of religiosity. So 7% of the population would consider themselves to be national religious, which is more or less akin to what we would call modern Orthodox in the US. And then we have another 26% of the population that considers themselves traditional, some more religious, some less religious. There's a range here that goes from people who, may keep kosher but not keep Shabbat, may keep Shabbat but not go to synagogue on Shabbat, may go to synagogue but not keep Shabbat. So there's a wide range here. And then about 21% of the population is Arab Israeli. And that segment of the population is also broken down into a variety of groups. So 17% of the overall population in Israel is Muslim, 2% of the overall population is Christian, another 2% are Druze. And why am I telling you about the breakdown of the population? Well, there are a variety of ways in which the populations are similar to one another, but there are also some very key and important differences across the population. So first of all, one thing that I'll highlight is the ages, the age structures within the population. Haredi Jews, the median age among Haredim is 16, as compared to a median age of 34 among non-Haredi Jews and 22 among Arab Israelis. So what you can see here is the the Haredi population is really quite young. Here you can also see 56% of the population among the Haredim is under the age of 18, as compared to 43% among Arab Israelis, and then many, many fewer among non-Haredi Jews. Same in terms of percent of married individuals age 20 and over, much, much higher among the Haredi population than among the Arab Israeli and non-Haredi Jewish population. And then critically, the fertility rate. There are very, very different across the populations. So while in Israel, the overall average fertility rate is 3.1, with approximately 3.1 children per woman of childbearing age, and that's the same rate that there exists on average among the Arab Israeli population. If you compare that to the Haredi population, there are about 7 children per woman of childbearing age within the Haredi population. And then the last thing that I want to highlight before I hand it over to Avi is to look at the poverty rate across the population in Israel. So this is looking at families living in poverty in Israel based on the most recent data from the National Insurance Institute from 2020. The poverty rate across the overall population is just under 21% in Israel. And this is based on disposable income. So that's after considering any taxes that people pay or any transfers that are paid to people. And then, of course, this differs across populations. So if you look here, whereas the poverty rate is around 18% among non-Haredi Jews, if you look at Haredim, the poverty rate is about 42%, and among Arab Israelis, it hits about 35%. It differs also according to families, the number of children in families. So while it's lower in families that have, the overall number in families with children is 23%, in families with 4 or more children, the poverty rate reaches 45%. And the last thing I'll show you is looking at the number of wage earners in the family. So families where nobody is working, the poverty rate is indeed very high at about 69%. Once you have one wage earner in the family, the poverty rate goes down to about 26%. And this, households with one wage earner, that would be more typical among Arab Israeli families, where it would be more likely for a man to work, and among Haredi families, where it would be more likely for a woman to work. Although in both cases, this is, there are more and more families in those sectors with 2 wage earners. When you get to families with 2 or more wage earners, the poverty rate goes down to below 8%. So that's just to give you a picture of some of the differences in the population in Israel. And I'm going to stop sharing here, and I hand it back to Avi, Pat.
All right, thank you so much, Susie, for that very helpful context, both on the work of the Taub Center and on the diverse nature of Israeli society, which I think will be very helpful as we continue with our program to understand the ways in which Israel has responded to COVID-19 pandemic. So it's a pleasure for me to now introduce Professor Avi Weiss, who is the president of the Taub Center. Avi Weiss holds a doctoral degree from the University of Chicago and has presided as a member of the senior faculty of Bar-Ilan University since 1988. He has served as chair of the economics department there between 2005 and 2008. His area of expertise is applied economics, and his research focuses on industrial organization, antitrust, labor economics, law and economics, and behavioral and experimental economics. Professor Weiss is the editor of the Economic Quarterly, the Journal of the Israel Economic Association, and is an associate editor of Economic Inquiry. Avi.
Thank you very much, Avinoam. Thank you, Susie, for what you presented. And I'm just going to jump right in and talk to you a little bit about what's happened in Israel. So we're going to divide that into 4 different parts. First, I'll talk to you a little bit about the medical side. Now, there was a number of people who have come down ill, although Nadav will certainly be able to tell you a lot more of that than I can tell you about that. Then we'll talk a little bit for just a few slides about macroeconomic impact, and then the labor market impact, and finally a drop about the welfare impact. So we're going to run through a lot. They say, a picture is worth 1,000 words. This one's probably worth a lot more, but I'm going to be giving you about 13,000 words. I figure 1,000 words talking in about 12 slides. So here we go with the first one. Israel is very, very unique in terms of what's happened with respect to the infections. It's been very strange all along the way. It's completely counter-cyclical to what's happening everywhere else in the world. And what you can see is that obviously at the beginning of the pandemic, Israel was doing very, very well, and the numbers were very low. And then Israel closed down early, and then Israel opened up early. They opened up too much, and they opened up too liberally at a very, very early stage relative to other places. And the result was this initial kick up in the number of infections. That then became much more significant in September, a week after the schools opened. The schools then closed, and the result was a second shutdown in which people were, again, stuck in their houses, and that was before the vaccine started. So the shutdown, it fell back down. We went in our second wave before anybody else, and then when other people were in their second wave, we were already where it had lowered significantly. Then came the end of January and the end of December and January, and the vaccination program in Israel again was the first one in the world, and it started in late December. I got my first injection in December, and that's a blessing on the one hand, and it seems to have turned out to be a curse on the other hand. But you can see that during January, when we had that second wave, that third wave, we were in a situation where the number of people who came down sick was incredibly high compared to pretty much any other country. Then we started getting vaccinations. The vaccinations are happening about over here. Do you see my mouse, by the way? Okay, so vaccinations are happening about here, and then we see it decreasing, obviously, and then Delta hit. Now, the thing is, Delta hit a little bit more than half a year after people had gotten vaccinated. And for many reasons, but for that reason also probably, Delta hit Israel very, very hard, because the amount of antibodies we had from the vaccination, we didn't know it at the time, but the amount of antibodies went down significantly. And our ability to not come down ill from it also went down to get together with that. So when the Delta came in, people started getting, it's also a different variant and has different characteristics, of which Nadav could tell us a lot, and I can tell you very little. But what you're seeing here is that our fourth wave was way before everybody else. They're just getting there now. Okay, they're getting there now. And we don't know how high that'll go, but it seems like it's not going to be insignificant. And it was incredibly high. And what you see, interestingly, is that the height of the wave, in other words, the number of people coming down ill per 100,000 has only been going up, even though we've been vaccinated, and it ended up going up a lot. Very possibly, had we gotten vaccinated later, like other countries did, this wave would not have been as significant. But we don't know that. Counterfactuals are very hard to do. Now, going into those populations that Susie was talking about, you can take a look at the cumulative infections per 100,000 people by the type of population living in that area. There are certain definitions we use here, but interestingly, what obviously stands out is this gray part right here to the right, which is saying that the ultra-Orthodox population in Israel came down ill a lot more than any other cities, any other areas inside of Israel. And where you see the minimum was for the Bedouin. Now, the ultra-Orthodox, I'll tell you in a second why that happened. It's very clear why that happened. Ultra-Orthodox will be in synagogue 3 times a day. They will be very, very tightly crowded inside. They'll be at the yeshivot, at the schools of higher learning, and they'll be there all day with a lot of different people. So there's a lot of contact. And therefore, there's a lot of infection going from one person to another. They also started closing down later than other populations did. The more surprising one is the Bedouin, why they're so low. Well, it turns out that the reason that they're so low is because they really didn't trust the system, and therefore they didn't tend to go get tested. They also were given lower ability to go get tested, but they really got tested very little, and therefore the number of infections was relatively low. Let's remember that there are many people who come down infected but don't have much in the way of symptoms, or perhaps any symptoms at all, and therefore we don't know that they came down infected. So it's possible that a lot more were ill, but we just don't know about it. And the other populations, you see that it's also low among the Arab Israelis that got infected little, which means that had they gotten tested little, had they gotten tested more, these numbers would probably be higher. But when you move to the most critical of the three graphs, this is telling you about the people who came down seriously ill, about cumulative hospitalizations. And what you're seeing here is very, very surprising given what you saw previously. What you're seeing here is that those with the highest levels of hospitalization, in other words, with significant illness, are among the Arab population. And for the Haredi, even though they had a lot of people came down sick, the percentage who came down seriously ill was much lower. The reasons for that are as follows. With respect to the ultra-Orthodox, it has to do with the age distribution. Susie showed you before that the average age in the Haredi population is 16. Now, young people were not getting seriously ill. So therefore, a lot of people were getting ill, but not seriously ill because of the fact of the distribution. For the Arab Israeli population, it deals with other illnesses. It deals with the amount of diabetes. It deals with the amount of obesity. These are all things that have a large effect on how badly the sickness hits you. With respect to the health, the last thing I'm going to show you is this graph right here. If you take a look at what's happening over time, mortality in Israel is going down. In other words, the health system is always improving, and the care that's given is always improving. And over the years, the level of mortality has been sinking. 2020 started, that's the orange line over here, and we were in really good shape and continue improving the situation in Israel. Then the pandemic hit. The pandemic moved us up significantly in September, and then I'm sorry, in the summer. And then when you got down to September, to that big wave in September, it got very, very high. The amount of mortality relative to what would usually happen. Then you have that December wave again, December and January. Now we're on this turquoise line, and January was incredibly high. Then it went back down as things got better. But today, when you go back to where we are now, these are the latest data that you can count on. Then again, we're at very, very high levels compared to where we would have expected to be. Running on to a couple of macroeconomic trends. So what you can see here is as follows. This is GDP per capita. We always do per capita in Israel. By us, we do per capita because of the growing population in Israel, which is very unusual for most developed countries. So therefore, if you take a look at GDP per capita, you can see that over time it was rising fairly linearly, and it was expected to continue to rise at the same rate as it had previously. So this is what would have happened. What actually happened is that we fell back by about 4 years. 2020 is similar to what you had in 2016, but it's made it up really quickly. And in fact, if I were to take the updated numbers, so there's some new numbers out, it would even be slightly higher than that. In other words, with a 2-year period, we're basically closing the gap. This isn't just Israel. It's happened in a lot of places, but it's been pretty spectacular that it's happened so quickly inside of Israel. One of the things that Israel did, and all the countries did, was they spent a lot of money in order to try to fight it. And the spending a lot of money in the case of Israel was raising the deficit from about, well, it had been under 2% for a while, but it had gone up to about 4% in 2018 and 19 for reasons I won't go into. But in 2020, it got up to over 11%. It's going to be high this year also because there was half a year of government assistance for those people out of employment, but it's expected to go down significantly. And what I'm going to show you here is the debt to GDP ratio, which is considered a very, very crucial measure of how well you look, how good you look in the world, in terms of what type of credit rating you're going to get inside of the world. Everybody, all the countries started from a certain level of debt in 2019 and then added to it because of all the different programs that the different countries did, and each country had a different set of programs. Israel, like everyone else, went up from about 60% in this case to about 72 to 73%. That's where it is, what was in 2020. It's going to probably be a little bit higher than that in 2021. And this is now where the arguments exist to a very large extent within Israel. Should we be aggressively cutting back the deficits and the debt, or can we say, you know what, Israel's in a very good shape economically. We don't need to cut back. We can take some of the money, a lot of the money that we have, and invest it in improved infrastructures. If you do that, if you do that and you do it properly, that's a big caveat. But if you do that and you do it properly, you can have a very, very large effect on growth inside of the country. And if you, but the cost will be that you will be at a high debt to GDP ratio. And that trade-off it's very much an argument now between the finance ministry in Israel and the Bank of Israel and us also. But we're going to see where that ends up. We don't know yet. If you go over to the labor market drop, you can take a look at those three shutdowns. And I'm only doing the first three here. And you can see that there are differences across the different populations. In particular, when you take a look at the ultra-Orthodox, you can see that the ultra-Orthodox always peaked higher. In other words, the number of people who lost their jobs was much higher. This occurs for the men and women for different reasons. For the men, it occurs because they have very low capital skills. They have very low human capital. They tend to be only studying yeshiva, and they don't have marketable skills. The result is that they are the lower level workers, and they are the ones who were let off. For the women, it has to do with the fact that a very, very large percentage of ultra-Orthodox women work in part-time employment, part-time jobs. And the part-time jobs are the ones that were let off, and not the full-time workers. And therefore, they lost their jobs more proportionally. For the Arab population over here, this is misleading. It's misleading because you had more Arab workers leaving the workforce altogether, and therefore they're not in the denominator. They're not there at all. And therefore it looks like it's a relatively low percentage of unemployment, but that's only because there were a whole bunch of people who left altogether and who stopped being part of the labor force. When you take a look at what happened with respect to working from home, which has become a very important issue and is part, as Susie said, of the conference we're going to be having next week, then you can see again the difference. First of all, you see the difference between women and men. And I think that's spectacular. Women are, it turns out in the jobs in Israel, women are more able to work from home than the men are. And I think that's a very interesting finding. That's with every population. But the other part you're seeing is the weakness of the Arab Israeli population, and that they are in types of work that doesn't really allow them to be able to use the new technologies to a very large extent. The Haredi ultra-Orthodox here are again misleading because of that same problem I discussed before. Running to our last issue, with respect to welfare, government expenditures on welfare obviously shot up. It shot up incredibly during a very, very short period in the beginning of 2020, throughout the entire year, and 2021 also. No surprise there. And when you take a look at how that's divided, however, well, we tend to divide between something called social protection and social investment. So social protection is well, let's use the old saying, is giving someone a fish, and so social investment is teaching them to fish. So what happened in 2020 and 2021 is, of course, it mostly, almost exclusively, to help people who suddenly didn't have a job or businesses that suddenly lost their livelihood. But there was a real opportunity to spend more on social investment. You had people stuck at home, sitting in front of a computer screen, who could have been given skills to be able to improve their labor market capital. And that just didn't happen. Not in 2020. It started happening more in 2021, but it's something that was to a large extent a missed opportunity. And with this, I'm going to pass it on, I guess, back to Avinoam.
Okay, thank you so much, Avi. I appreciate the sort of both the macro and the microeconomic perspective, and there's a lot of data there for us to analyze and to dig into, which I will remind people to please feel free to use the chat function as you have questions that you're thinking about as you hear the presentations, and we'll have plenty of time for Q&A at the end of our program. So it's a pleasure for me to introduce our third speaker today, who is Professor Nadav Davidovitch. Nadav is a principal researcher and health policy program chair at the Taub Center. He is also an epidemiologist, public health physician, and head of Ben-Gurion University of the Nadav School of Public Health. In addition, Professor Davidovitch is chair of the Association of Public Health Physicians in Israel, the official Israel representative of the Executive Committee of the European Public Health Association, a member of various committees of the Israeli Ministry of Health, including the cabinet of the Magen Yisrael program, a national program for fighting the coronavirus, and a member of various international committees, including the task force on the coronavirus of the European Association of the School of Public Health. And I should also note that Professor Davidovitch is also part of a joint initiative between UConn and Ben-Gurion University and the International University in Rabat, which is part of our Abrahamic initiative as well. And finally, I should say that Professor Davidovitch has clearly figured out how to clone himself, because he does all of these things at the same time. So with that, I will turn the screen over to Nadav. Thank you, Nadav.
Thank you so much, Avi, for your kind introduction. So first, on the personal level, I joined the Taub Center about 5 months ago. It's a wonderful family, and I'm going to talk to you today about this whole idea of health in all policies, and Taub Center is exactly the place where you can actually implement these ideas, because we know that healthcare finally is determining about 10 to 20% of our health, and the rest, of course, social determinants of health, economic and environmental and political determinants of health. So when you have a center that is dealing with all different topics that Susie presented, and Avi also showed us, it's an amazing opportunity to integrate different kinds of knowledge and data for better policies. So Avi presented, the pandemic, and I maybe leave it to the Q&A because I have lots of things to say, because it's very complicated and it's very hard to compare different countries from a variety of reasons. And of course, as Avi pointed out, there's a big difference between positive testing. Many people can be very asymptomatic, especially children, and hospitalization rates and deaths. So we need to be very careful sometimes, because sometimes we're comparing oranges to bananas, like maybe different parts of Israeli society. So this is why it was so important also that Susie presented the introduction. So I'm going to focus on initially on vaccinations, and to show you actually that in many ways COVID is a mirror reflecting previous aspects and structures and problems around the globe, both on the national level and international level. And after explaining a bit about what happened with the vaccination campaign, it's been a roller coaster, and we just hosted the Israeli Public Health Physicians Association. Professor Arnold Monto is you probably all know him. He's a very close friend. His granddaughter is living in Israel. He is the chair of the FDA subcommittee on COVID vaccines. And it's interesting because, in Israel, from the 80s onward, actually, for example, the Arab Society, they had the highest vaccination rates. And we published a paper years ago showing that in contrast to many other things, vaccination rates on the routine schedule, in contrast to other healthcare services, actually low socioeconomic group are vaccinated better. But currently, unfortunately, the situation is very different, and we see clearly many things that Avi showed are also going there with the vaccination campaign. And here you can see, as Avi mentioned, I also was vaccinated I think I was vaccinated the first day after the Prime Minister and the President were vaccinated. And you can see, and again, if we can go, we don't have the time. It's much more complicated because between January to March, we had an amazing pace of vaccination. Then you can see here that there was some decline going up, and this is just with the second dose. And you can see how we got by April into the really great opportunity when we had the Alpha variant that is much less infective than the Delta variant, and probably we almost got into herd immunity. Then what happened, that unfortunately, like in the previous waves, we lost time, and vaccination pace was again very slow. We didn't prepare, like in the previous waves, in between waves, how to open schools. And in Israel, many times we are excellent in doing vaccination campaigns and emergency preparedness, but probably a bit less in preparing for the long term. And here you can see, I think it's telling us the whole story. You can see the COVID-19 prevalence according to SES. So you can see that the lower SES, the prevalence is higher, and it's reflecting what Avi was showing us. And you can see the COVID-19 vaccination. And this is just related to, it's not on the personal level, it's on the city level, according to different cities and their SES. And here you can see different cities. The red ones are mainly, this is Jerusalem, for example, and you can see a clear correlation between vaccination rate, SES, and disease prevalence. Okay, so this is something that is very interesting to remember. This is the vaccination rate for age 60 and above. And what I want to present now for the preparation for the future is a committee I'm part of on the European level. And what we need to think, and Israel is part of the WHO, the World Health Organization European region. So what we can say that we have the pre-existing health inequalities both in Europe and in Israel. And again, Israel is within the European region of the WHO. And it's quite clear, and I think after what Avi presented you, that unfortunately we are going to see, or there is a danger to see, health inequalities getting much larger. And the question is how we can move into some plan to set out policy goals and the capacity to reduce the pandemic impacts and exacerbation of health inequalities. Because finally, COVID is not just, from a public health perspective, is not just about counting cases. It's about the consequences of closing schools and how this influence in different ways, different socioeconomic groups. You know, going online can be a wonderful solution in Ra'anana, but maybe an awful solution for a Bedouin society in an unrecognized village. A certain working opportunity that will open in high tech or other places can be amazing for certain parts of society, but for other parts, it can be a disaster where many jobs were taken. So it's very dangerous to speak about average influences. We must differentiate, and this is what we're doing at Taub Center. We're trying to differentiate according to socioeconomic status, according to education, according to child development, and all of that, in order to see how we can have universal programs, but that are adapted to different parts of a society. So on Lancet a few years ago, we published a paper about syndemics and the right to health. So before, when preparing to this talk, Casey asked me, what is syndemic? So syndemics is a very important term now being used in public health policy. Syndemic is when you have the intersectionality of different things that are working together. Okay, so you cannot differentiate education level, socioeconomic status, housing conditions, chronic diseases. They're all intersecting together, and especially when we are talking about social determinants of health. And here you can see how health-related practices are embedded in community networks, social determinants of health, and political, economic, and environmental conditions. This is the way that we need to think further when we are, we're going to see how to develop sustainable policies related to COVID. So we need to think about the new normal. But again, all these things existed before COVID. COVID is mainly a mirror. I don't think that COVID changed my perspective in terms of what needed to be done. I'll give you one example. We are researching it out. For example, the question of home care and home hospitalization. This was true before COVID, but COVID showed us the importance. This is a paper we published about the need to tailor measures for vulnerable cultural minority population. We are working at Ben-Gurion University, for example, with the Bedouin community. At Taub Center also, we are doing different studies about these different groups. And I think, kind of my main messages, for me, COVID, is a warning sign. Climate change it's already here and it's going to influence public health in a much deeper way. And if you're going to see how health is integrated across different sustainable developmental goals, so you can see here issues such as poverty, education, gender equality, sustainable cities, all things that Avi showed you the data. We need to see how we are going to do health in all policies. And we have a problem here because everybody understands that we need integration, but it's not working. There is the paradox of prevention and other things that we can talk quite a lot. And I think this is our role at Taub Center, to integrate and to show this importance. So some of my main messages: governance of COVID-19 requires collective action based on health in all policies approaches, and not just about healthcare. Healthcare access is, of course, crucial. I'm fighting for health equality in the Negev, building another hospital and all of that. But probably improving mothers' education might be even more important sometime to reduce infant mortality rates, for example. And the cliche that COVID-19 knows no borders, etc., this is in many ways not true. We saw by Avi's presentation and mine how it affects more vulnerable population. And finally, we have the epidemiological data, but we need to have the norms and our social values of solidarity and health equity. This is part of the National Health Insurance Law that was enacted in Israel. By the way, in Israel, we're fortunate that both the right and the left voted together. Likud and Labour Party, now it sounds almost like science fiction, but they voted together for National Health Insurance Law. And I think this is our legacy in Israel, in Zionism, actually, even before the state was established. If you read Altnolen by Theodor Herzl, how public health was perceived as, not just as a scientific achievement, but also to improve society. And just to finish by citing Gina Kolata from New York Times, it's one of my favorite health reporters. So she's citing two very close friends, Alan Rand from Harvard. He was the Dean of Faculty of Art and Sciences, who was one of my PhD advisors, and Dora Varga from University of Exeter. As an epidemiologist, I want to tell you that we are not going to decide when the epidemic is over. Of course, COVID is going to stay with us, but how to learn to live with the disease, not in a passive way, but investing in infrastructure, as Avi said, and how epidemic end. This is something that will be a socio-political processes, and this is our role, as researchers and policymakers, to see that when the epidemic ends, and again, COVID is going to stay with us, but we need to learn to live with it. We are, as a society, need to say, what are the policies that we need to put forward based on data analysis, but also on our social values. Thank you.
Okay, thank you.
Avi, just one thing that I want to announce, that I was nominated officially by the Ministry of Health as chairing the strategic health inequities policies by the Ministry of Health. So I hope, Avi and Susie, that we can, it will be a good venue to influence. We're meeting tomorrow Michael Marmot. Some of you maybe know him. He's the master of social determinants of health inequalities, and we're going to start working next month. And I'm sure that I'll be using Taub work there for sure.
Congratulations.
Thank you.
Thank you so much, Nadav. So let me bring everyone back to the screen here, and I'll just use this moment to remind people that we just got a lot of different information about sort of both the complexities of Israeli society, the economic impacts of the COVID-19 pandemic, and also some of the public health aspects of it. And so I want to remind people that if you have questions, and I see people already typing in questions into the chat, to please go ahead and do so. And if you prefer, you can use the reactions function and raise your hand to ask a question if you'd rather ask it in person. So let me start off with a question which can go to all of you. So Nadav, you mentioned there that sort of we can see in the responses to the pandemic a reflection of some of the existing social issues that the society had before, the socioeconomic issues. Although one of the interesting things, and I think will be interesting for our audience here in the States, is we can see that in the United States, the response to the pandemic has very much become politicized. And so I'm wondering if each of you, whoever wants to start, can talk about sort of some of the political aspects of the response, both in terms of, as you talked about, sort of having a robust public health apparatus, but also ways in which maybe sort of politically, how was the response different in Israel from what maybe we've seen here in the United States, and what lessons, both positive and negative, might we learn from this in terms of, how politicians can respond to a pandemic? So whoever wants to start,
I'll be happy to start. Is it okay, Avi and Susie? I think, of course, there are many different aspects to answer, because there is it's not a yes or no, of course. And by the way, we're doing a study comparing 24 countries about the role of scientific advisory committees to to governments. So you have this science policy or science politics interaction, and it's fascinating. I think that Israel has a very robust system for pandemic preparedness. I'm dealing with it already for 20 years. I was the head of epidemiology department in the IDF. This is why it was so frustrating that at the beginning, it looked like, okay, let's throw away everything and start from scratch. And I think that a major part of it was because we had a provisional government then. And all decision-making was very, very centralized. So on one hand, Avi is right that we were successful, but we set several mechanisms that were very bad. And although we were very successful because we closed the country, not involving the health funds, we have 4 nonprofit health funds, not involving other mechanisms, created many problems that took non-COVID issues, for example, and were very neglected. So this is one aspect how the different governments reacted. We, for example, had the security services doing contact tracing as the head of chair of the Public Health Physicians Association. I was totally against it. Until today, I think it was a wrong move, both from a utilitarian perspective and also from the long term. So this is also related to Israeli politics. I think this is a move that will never happen in some other countries in, I don't know, in Europe for a variety of reasons. So there's also the question of the military entering. And I finished because I have a lot to say. I finished just by saying that there were other interesting political issues here, especially the high holidays, not that these ones, but before, that we had on one hand the Haredi very angry about issues of praying synagogues, and on the other hand demonstrations against the government, and this was like 2 worlds apart, and for me it was very sad. These holidays, I think it was much better. By the way, I was praying outside, and you know that Yitzhak Avinu was. It was said that he was praying in the field, and anyway, so I think things became very politicized because of the political situation, and it was reflected in different polls about trust. So the first wave, people were quite in shock, and it was indeed very successful, but later on, many things were interpreted, even if they were not so, as coming from political interest. I'm telling you that most of the time this was not true, but sometimes when you don't trust the government from both sides, including now, by the way, so you tend to interpret things. But this is a very short answer. There are many different levels, and I'll stop here.
Not much for me to add to that. I mean, obviously Nadav went through a lot, but he's right. Israel, unfortunately, has a lot of experience with emergency situations. That when some place is getting bombed, etc., everybody really listens. Everybody knows how to follow instructions, and that helped Israel a lot to be able to, early on, be able to do what was needed in order to keep things under control. But we were in the middle of 4 sets of elections. Because we do elections twice a year here, it seems, and that definitely had its effect. And the effect was that no matter what the government tried to do, or many of the things the government tried to do, there would always be the people on the other side who would say, well, that's no good. And therefore, you were getting a lot of misinformation in addition to a lot of pressures. And it played out very much on the economic side also. Do you close down? Do you not close down? What about the economy versus the health issue? And that became a huge issue that became quite politicized, among others.
The only thing I'll add is that with regard to vaccinations, at least in the first round, in Israel, we didn't really have politicization of the issue of vaccination in the same way that it has been politicized in the US. I'm not sure that's the case anymore with regard to the boosters, where we have, I think, a little bit more division in terms of the desire of people to go ahead and get the booster shot, and less, Nadav, correct me if I'm wrong, but a little slower uptake of boosters than we had of vaccinations in the first round. So
Right.
that's one major area where we really didn't see it politicized. Nadav, you're muted, but
Sorry, yeah, no, yes, but it's much more about socioeconomic status than about, it's
Right.
not politicized as in the US.
Mhm.
Also, masks are not politicized as in the US.
Right. Mm-hmm.
And in general, health is not politicized. There is a small, maybe 3% anti-vaxxers that are very vocal. I'm, for example, going to be, I'm a Nazi physician that's going to be on trial because I'm promoting vaccination, and it's horrible what's going on in the social media, but this is not the, most Israelis really want to be vaccinated. Many of them are hesitant, but it's not so political as that. I mean, there is some connection, but it's very different than in the US. Health is perceived in a different way. By the way, and sorry, Susie, to interrupt, but another interesting issue is the something that Taub is also doing lots of research is the health workforce and planning workforce. So we have many, all components of Israeli society are there. So both ultra-Orthodox and Arab. I'm not saying that everything is smooth, and we had the in May, you know, if you remember all the Gaza attacks, etc., and there were tensions and racism. But if you compare to the U.S. Within the healthcare system in Jerusalem and in Beersheba, you know, Bedouin physician working together with a Jewish physician, and this can serve as a bridge to understand, and these are also things that we are studying at Taub, and it's a point of source of empowerment, I think.
Okay.
Thank you. So one question that comes in the chat from my colleague Jeremy Pressman, who's a political scientist and director of Middle East Studies and one of our co-sponsors of today's program. It's a follow-up for Nadav and for others, and he asks, has Israeli society view of public health officials changed at all during COVID, and if yes, how? And I think you touched upon this before, but can you say a little bit more about you know, would you say in terms of trust levels, has trust in public health officials increased, decreased over time? Has it changed in terms of the role of public health officials? Has it become more or less politicized? Can you say a little bit more about that?
So I'm involved in several surveys, and things are very dynamic. In general, trust in public health officials is very high. In Israel, the issue that I mentioned was much more about the politicians, or you know, the Minister of Health or the Prime Minister, Netanyahu or Bennett. Right now, I want just to mention something that is common to US and Israel, and this is very unfortunate, and this is the burnout and even trauma. I'm talking even about post-trauma, and I'm serious now about public health officials. And I know that I have a PhD student that just got back. He was the New Jersey Department of Health. He was the chair of, his name is Yanai Krenzler, and he was the chair of public health at the New Jersey Department of Health, and now he's working with me in Israel. I think in the US, about 40% of public health officials resigned because of the burnout. In Israel, also many of them resign, including in high positions. And I'm telling you that I'm very frightened that people are saying, yeah, now you got public health in the front line, and everybody knows, you know, what is flattening the curve and the R and everything. There's a danger that the healthcare system will be really, really weakened dramatically. I know it sounds maybe counterintuitive, and there is some investment that never happened in the past, but what's happening now in terms of burnout, it's horrible. And there are changes now in the current budget, but for the long term, Israel, and I'm saying it also as I'm still on reserve and I served as a brigade physician, etc. We're very good in doing emergency things and much less in doing the long-term kind of care, not just for the health officials, but also for long COVID, for example. We're going to have in the Ministry of Health next week a discussion about long COVID clinics. They're not exact. There is no clear budget or even basket for them, not only in Israel, in many other places, but this will be the long-term consequences, and we need to prepare for them. The mental health issues, and again, health inequalities here and social inequalities are very important because some people even gain. I know many families that gain from COVID because they spend time together, but many others no. And so we need to to be much more differential in our response now.
We have another question that's come in the chat from Jill, who asks about vaccination rates. So do vaccination rates for each social group differ or differ over time? Can you say a little bit about what you're seeing, in terms of the first, second, now third, among the different social groups?
Both. I mean, we see the dynamic that we had a delay. Usually the first to be vaccinated are is in the center, Jewish, higher socioeconomic groups. And then you see a catch up with programs and targeting specific groups. So it's a question of access. Of course, the vaccines are for free, but physical access to health literacy, and also sometimes you can open clinics, but again, the Bedouin living in an unrecognized village, it will be very hard. So sometimes it takes time to adapt to the different places, and this happened with the first and second dose, and also with the booster, and also with children. So we are fighting for many years to have a law about a vaccination encouragement. I don't know how to translate it, meaning that we need to invest in infrastructure and the health promotion, the workforce to do so, because we're doing lots of things. I'm volunteering on the social media and doing webinars to fight fake news, but we need to have these people, paid by the government and doing the work, not volunteers, because it's hard to do so for so many months. So we have like campaigns for 1 month, 2 months. Magen David Adom is going to the city squares, etc. And then, like we had in April, things are slowing down. Delta entered, contact tracing went down, and then boom, we are back again. And I'm afraid that we're trying now not to do so after the fourth wave. And we need to see.
Avi, in terms of the long-term economic impacts that you're seeing, I mean, can you speak a little bit about whether you think you talked about the differentials between the men and women in the workforce, existing social divides. I mean, do you think that there's going to be sort of long-term impacts, that divides that already existed that are going to be exacerbated, or is this going to affect certain changes that needed to take place in terms of Israel's developing economy that are going to be accelerated because of the pandemic? And can you say a little bit more about how that political decision-making that needs to take place now about where to invest in terms of the budget and deficit, how that calculation might affect sort of the future economic divides?
So, okay, thank you, Avinoam. So if we had a blackboard here, I would spend the next hour and a half trying to answer that question. But since we don't, I'm just going to do it off the cuff. So Israel is very much a two-sector country, and there is the high tech and the people who do very, very well in Israel, and then there's the rest of the economy, which is close to 90% or about 90% of the workforce, which are at a very, very different place than the high tech in Israel is. And the high tech has done very, very well, but you take a look at who lost their jobs for part of the time, who never ended up going back to work in the meantime, and what's happened to those families. You see that they that the gaps are increasing. It's not that they're decreasing. You're having a bigger difference, and this is where I go back to what I talked about before about a missed opportunity. we have a lot of the Israeli working public, or Israeli workers in general, who have a very low skill level. And this was a true opportunity to improve their skill level while they were sitting at home not working. And that could have been done, and it wasn't done, or it was done very, very minimally. And only now, and it happened because of political arguments between two different ministries. And the result of that was, as I said before, you missed the opportunity to take some of those people and to give them the skills to go to middle-level jobs. And that could have made a huge difference with respect to the Israeli economy. You're seeing right now in the Israeli economy a very big lack of workers at the upper end, a lack of workers at that middle to top end, because you don't have people, because you have lots of people down at the bottom, and there they don't need as many people. And of course, tourism is still mostly closed, and restaurants aren't as active as they used to be. And the result is you had a lot of loss of work and workers who don't have the training to be able to move themselves up a lot. And they need a lot in order to be able to get there. So for now, what you're having is increased gaps rather than decreasing gaps. And to close that, so you get back to what you just mentioned about making those investments, that makes it fairly clear where you need to make those investments. You need to make them in infrastructures to the weaker populations, which includes transportation, which includes high-speed internet, which includes equipment, and which includes human capital training, which will allow those weaker populations to be able to move themselves up to improve their lot. And then you could get to a situation where you would lower the level of inequality, lower the level of poverty that Susie was talking about, and that would be a real opportunity. So, you could have done this, but you can still do it. There's still a big opportunity there to be able to improve things, and that's what the discussion is all about.
Thank you, Avi. It's so interesting to think about sort of both, as Nadav was talking about this moment being a reflection of sort of current social, economic, health divides, but also to think from the political standpoint about the opportunities that are presented by this moment. And here in the United States, as we have sort of wrestling over major new budget bills and infrastructure bills, this is exactly what seems to be happening here also, thinking about that as well. Right. I do want to mention, and Susie, if you want, feel free to unmute if you want to add anything to what we've talked about here. I do want to mention that Nadav raised an important issue, which is sort of trauma and burnout, not only for people who have gone through the experience of the pandemic, but also for frontline workers, people who are in healthcare professions. And one of the things that we'll need to do over the course of a long future, and this is me as a historian speaking, is thinking about sort of the long-term impacts of the pandemic on the globe and on societies. And I should mention that one of my colleagues here at the University of Connecticut, Sarah Willen, has started a project here at UConn that's also a global project that's called the Pandemic Journaling Project. And I just put a link in the chat to the Pandemic Journaling Project, which is basically an initiative to encourage people to journal about their experiences over the course of the pandemic. And they've collected thousands and thousands of journal entries from dozens of countries around the world. And it's creating a global archive where we'll be able to really sort of learn about the impact of the pandemic over now the last 18 months and for who knows how much longer. So I just wanted to mention that, and you'll see in the link, you can learn more about the Pandemic Journaling Project through there. I see we have, go ahead, Susie.
I just want to say, Avi, that, obviously this is an issue, a huge issue in Israel in terms of the major rise in the percentage of people who are seeking mental health treatment, who are experiencing depression and anxiety, seeing huge leaps in that. And it falls upon a system, unfortunately, that was already, understaffed, under-equipped to deal with mental health challenges, that already had very, very long wait times for diagnosis, very long wait times for treatment by a psychologist, and it particularly within the Arab-Israeli sector and within the Haredi sector, where there are fewer clinicians who are equipped to work with appropriate for those populations, but also throughout the entire population. So we're seeing huge challenges in that area here.
Yeah, definitely, and we'll see the long-term impact as well, for sure. All right, why don't we take one more question before we wrap up? I see that Judith has a hand up. I don't know if Judith, if you're able to turn your camera on, but I'll have you unmute so you can ask your question. Please feel free to go ahead and unmute and ask your question. Thank you.
Judith's husband, Leon. Are all members of the IDF required to get a COVID shot?
Okay, so thank you for the question. I think it came from Leon. The question was, are all members of the IDF required to get a COVID shot? And there was a previous question that had come in also about sort of the demographic breakdown of those who are in the IDF. So can you say something about sort of as a vaccination campaign, how does this work in the IDF?
So I was many years ago in charge of all these vaccination campaigns. Yes, all are required. Nobody's tying up, taking the person and giving a shot, but it's like a command. But you are persuading people to be vaccinated. Of course, at the beginning, it started in a gradual, because Israel started with chronic diseases. So it was usually the IDF is autonomous to make its own decision, the Surgeon General, but usually they're following, they're part of all the national discussions. In terms of course, most of the military are 18 to 21. Those who are on Keva, how you say it in English? I don't know. Like professional states, they are professional, but the minority. And of course, there's a very tiny proportion of some parts of the Bedouin community or Druze that are going to the military, but otherwise it's mostly Jewish, and also women less represented. But that's another story.
As far as the breakdown in the IDF, it's obviously different than it is for the whole population, because the Muslim population does not serve. The Druze do, and as Nadav just said, part of the Bedouin do, but a relatively small percentage. And the percentage of ultra-Orthodox inside of the IDF is much smaller than their share among the Jewish population, or their share among the entire population. But with respect to the rest of Susie showed 5 categories of the Jewish population, the Haredi and everybody else. For everybody else, the percentages would be very similar. The breakdown would be very similar to what you saw over there.
But
go ahead, Nadav. Yeah.
No, there's the Army Health Branch and the Medical Corps, and working together with the government and similar policies.
Okay, very good. All right, well, this has been a really sort of thought-provoking and very detailed analysis of Israel's response to the COVID-19 pandemic, and I think also gives us a lot to think about. Please join me, first of all, in thanking the Taub Center and our 3 experts from the Taub Center for joining us here today for today's program. We'll do the virtual round of applause. Thank you, everyone, for being here. I want to thank our co-sponsors for today's program. In addition to the Center for Judaic Studies and Contemporary Jewish Life at the University of Connecticut, our Office of Global Affairs, the Middle East Studies program here at UConn, and of course, the Taub Center for Social Policy Studies in Israel. It was a really excellent program, so thank you to the 3 of you. It's wonderful to see all of you. I wish we could be together in person, but in the time being, we will thank Zoom for being here. Thank you, everyone, for being here today. Thank you.
Thank
Thank
you,
you.
Avi, for organizing this. And thank you to
Avi.
Casey from our team for her help in putting this together.
Thank you, Casey. Well done. And thank you, Avinoam. Thanks,
Thank you.
everybody.
Thank
Thanks,
you all.
everybody. Stay safe.
All right,
Bye-bye.
stay healthy, stay safe. Bye, everyone.